Hi, Mark Moore again here from More Physical Therapy. One of the main things we do is teach people how to stretch, or strengthen as well. But and if there was one most common stretch, muscle stretched in the body, I would say that stretch would be the hamstrings. If I ask my patients, do you stretch? Usually they say, oh yeah, I do stretches all the time. And I'll say, what stretch do you do? And almost everybody says this stretch where they reach down toward their toes and they stretch the hamstrings. The hamstrings are the muscles that we find on the back of our legs, okay? And yes, when you bend forward to touch your toes, you will stretch those muscle groups. These are some of the biggest muscle groups in our body. But it surprises me how few people know how to stretch the hamstring in all the ways that we can do it. So the common stretch for the hamstring, I'm going to demonstrate here with Ellie. I'm going to have her lay this opposite leg flat. So we're stretching here this right leg of hers. So the common stretch is the leg is straight and we pull this up. And as we pull this up, the muscle, the back of the leg, the hamstring, gets lengthened out and tight, and you feel a stretch across here. And usually you feel this stretch behind the knee. It's kind of a painful stretch. If you push really forcefully, you'll feel a painful stretch back here. It's kind of stingy. And that's the most common way we stretch it. But here's a simple way to modify that stretch, and it's a stretch that I think is even more effective. Okay, have our knee bent, not straight, and bring this knee toward your chest as close as you can. And Ellie, go and take a hold of your hands there behind your knee. There you go. And then with your leg in that position, then go towards straight. Now you won't get all the way straight. You can see Ellie's knee still a little bent, but she should be feeling a stretch now right in the middle of that muscle belly, as opposed to back behind the knee. And it's not as stingy, it's not as painful, and you can get a really good stretch there. She's actively pulling that leg that way. If I was passively doing this, then I would just push myself through her foot. But this is a great way to get, in addition to the other hamstring stretches you're doing, to get that hamstring really isolated and to get the muscle belly, the center of the muscle belly stretched out, not just the tendons behind the knee. One more thing that's really important to know is that for people who have lower back issues that are having nerve symptoms that are going down their leg, this is really the only way you can stretch the hamstring without negatively affecting that nerve that is having a problem. If you're having those radicular symptoms like what we call sciatica or radiculopathy. And so for those patients, you have to know this stretch to be able to stretch your hamstrings out. And so that can be a big help. Hopefully you can integrate that into your low back stretches or with athletes to your pre-performance stretching, or even after you exercise to gain that increased elasticity in your muscles to increase your performance.